Hello. Welcome to this multiple choice quiz. It's time to test your knowledge. Without further delay, let's get started. Question number 1. Joe has medication due at 8 a.m. on the first day of the month. There is no medication or treatment record available for the new month. What would you do? The answer is letter A. You cannot give medication if the MAR is missing. Therefore, this medication must be transcribed on a new medication sheet. Contact your manager or provider to make them aware of this situation. Question number 2. Staff assigned to administer medications is talking to another staff and accidentally gives one individual's medications to another person. What would you do? The answer is letter B. This is considered a medication error. You are mandated to report any incident you witnessed. Report to your supervisor and document on an incident report. You must also follow your provider policy for medication error. Question number 3. Due to traffic backup, you arrive home from the community program at 6 p.m. Medication was to be given to Joe at 5 p.m. What would you do? The answer is letter A. Make sure you check the Standing Medication Order Form, SMO, or Late Medication Order Form to see what medications can be given, if any. You must also document per your provider policy for missed, late, or refused medications. We're not at the final question. Number 4. You hand Joe his medications in a medication cup and turned your back to prepare Sally's medication. Joe places his medication cup on the counter without taking them. Tom picks up the cup and swallows Joe's medication. What would you do? The answer is letter A. Follow your provider policy for medication errors. This scenario has multi-levels. First, you should always prepare one person's medication at a time. And prepare one medication at a time. You are also required to make sure the person swallows the medication and document immediately after the administering the medication. If a person accidentally takes another person's medication, they will need to be taken to the hospital for further observation. If the person is responsive and has difficulties breathing, call 911. If the person is responsive and has no problem breathing, call poison control. An incident report is required for all medication errors. We are at the end of this quiz. How did you do? If you got all 4 questions correct, congratulations. Well done everyone, your brain just grew a little bit bigger. That's all for now.